Good day, my audience. You're welcome to Dr. Fred Academy. Today we shall be looking at the external features of the heart of the dog. This is the heart of the dog. Okay. Now, studying the external feature means identifying the structures present on this heart. First of all, the heart is cone-shaped. Okay. Is cone-shaped. This is the base of the heart, okay, that bears the great vessels. It faces dorsally, and then this is the apex of the heart, which projects or points ventrally. This is the apex, it points ventrally. Alright? Okay. Now, this is the left side of the heart, while this is the right side. Okay, this is the left and here is the right side. This is the cranial aspect, while this is the caudal part of the heart. The heart generally is divided into 4 chambers. Okay, we have the left and right atrium internally, and then left and right ventricle internally as well. So these demarcations are now shown externally by just few structures. For instance, the atrium, which is located towards the base of the heart, is separated from the ventricle, which is located towards the apex, by the coronary groove. So this is the coronary groove. Okay, what we have here is the coronary groove of the heart. It carries or houses the coronary vessels. Okay, this is the coronary groove. It separates the ventricles from the atrium. The atrium from here upwards, while the ventricle is from this point downwards. Okay, now we also have longitudinal grooves that separates the left and the right ventricles. For instance, what we have here is the left longitudinal groove. This is the left longitudinal groove. You see, it runs from the coronary groove down to the apex of the heart. Okay, this is the left longitudinal groove. We also have the right longitudinal groove. Okay, though not very prominent on this structure. It also runs from the coronary groove. This is a coronary groove. Okay, it is filled with fatty tissues. Okay, so this is the left, this is the right, the right longitudinal groove. Okay, having talked about the grooves, the coronary grooves and the longitudinal grooves, let's look at what differentiates the left ventricle from the right ventricle. Okay, now the left ventricle, since it is a part that pumps blood to the body, okay, it is actually more hard to touch. Okay, when you feel it, when you palpate, it is harder than the right ventricle, which is softer to the touch. Okay, this is the right ventricle, while this is the left ventricle. Okay, let's look at the great vessels of the heart. The great vessels of the heart includes the following. Number 1 is the aorta. The aorta actually originates or begins from the left ventricle. So this is the left ventricle. It gives off the aorta. First of all, it forms the aortic arch, which is just a short curve, okay, from the left ventricle. A short curve. This is the aortic arch. So this is actually the aortic arch. We take away this part a bit, okay. So this is the aortic arch. This is the aortic arch. All right. Okay, and then this is the descending aorta. The descending aorta. The first branch of the aorta is the brachiocephalic trunk. This is the brachiocephalic trunk. It's actually the first branch of the aorta, the brachiocephalic trunk. Okay, and then the second branch of the aorta is the left subclavian artery. This is the left subclavian artery. All right. Okay. Now, let's look at the right side. Okay, the right ventricle actually gives off the pulmonary trunk. Okay, I didn't say this, that the aorta is what pumps blood to the body, okay, to every part of the body. Okay, and then we have here the pulmonary trunk, which pumps deoxygenated blood, okay, to the lungs. It carries deoxygenated blood to the lungs. It actually comes out from the right ventricle. Okay, this is the right ventricle. And then you must note that the right ventricle almost wraps around, or wraps a bit around the left ventricle. Okay, so you can see this is the right ventricle. Look at the wrapping formation. Okay, see the way it goes around the left ventricle. Okay, trying to enclose or wrap around this left ventricle. Okay, and then this formation at this point, this is called the conus arteriosus. All right, the conus arteriosus. All right. Now it gives off the pulmonary trunk, which supplies deoxygenated blood to the lungs. There's also a ligament here which holds the aorta to the pulmonary trunk. This little ligament, it is called ligamentum arteriosus. Okay, the ligamentum arteriosus. Okay, let's look at the veins. Let's look at the veins. Having looked at the artery and the aorta and the pulmonary trunk, let's look at the veins. Okay, here, let's use this to make it clearer. Okay, now what we have here is the cranial vena cava. Okay, this is the cranial vena cava, and then this is the caudal vena cava. Okay, both the cranial and caudal vena cava, they bring in deoxygenated blood. Okay, they drain blood. Okay, let me start this way. The cranial vena cava drains the head region, okay, while the caudal vena cava drains the trunk and the limbs. Okay, that is the hind limbs. Okay, these two bring in deoxygenated blood from the rest parts of the body into the heart. Okay, that is the pulmonary trunk. It brings in deoxygenated, the cranial and caudal vena cava, brings in deoxygenated blood from the rest part of the body into the right atrium. Okay, the other vessels here are the pulmonary veins. All right, I have the pulmonary veins here. They actually bring in oxygenated blood from the lungs. Okay, from the lungs, they bring in oxygenated blood from the lungs into the left atrium. Okay, this, as I said earlier on, is the cranial vena cava. Okay, what we see here, the vessel attaching to it here is the azygos vein. All right, so we'll stop here today, as I will always advise that you subscribe to Dr. Fred Academy and do well to click on the notification bell icon when you have subscribed, so you can get our videos any moment we upload one. Thank you.